Most people believe that once they use condom, that they are protected from every sexually transmitted disease. But the truth is that yes, condom is effective in protecting you against sexually transmitted infection. But there are some diseases that condom cannot actually or fully protect you from. So that is what we are going to discuss in today's video. I'm going to be mentioning some of those diseases and why it is so. Condom works mainly by creating a barrier. They stop the exchange of body fluids like semen, vaginal fluids, and blood. That is why they are very good at reducing the risk of infection like HIV, gonorrhea, and chlamydia. Even at that, it's still not 100% safe. But here's the important part many people don't actually realize when using condom. Not all sexually transmitted infections spread through fluid. Some spread through skin-to-skin contact, and condoms cannot cover your entire genital area. So if the skin of an infected person touches the skin of someone that is not infected, particularly if there's an open sore or wound, infection or transmission can still happen. So let's start with the most common one, which is HPV, human papilloma virus. I know some of you might have heard this HPV. HPV is incredibly common. In fact, some person may have this virus living with them and they are not aware. Reason because sometimes it doesn't cause any symptoms. It does not cause symptoms. So how will you be aware without testing? Now you need to understand that the primary mode of transmission of human papilloma virus is through skin-to-skin contact. This most commonly occurs during sexual activity because this virus actually lives on your skin and your mucous membrane. Penetratory cells or maybe exchange of body fluid like your semen is not required actually for its spread. So even if condom covers the penis, areas around the genitals that are not fully covered can still carry this virus. Someone can still get this HPV despite using protection, and some strains of HPV can lead to genital warts, while others can lead to cancer like cervical cancer. In fact, it is no longer news that HPV, human papilloma virus, is one of the leading causes of cervical cancer. This is why HPV vaccine is very, very important, especially before becoming sexually active. That is why it is important to protect yourself. Nobody actually owes you that responsibility because your partner might not even be aware that they have this virus. I told you earlier that HPV can be in your body for years without symptoms, without showing any sign or any form of symptoms in your body. So if there's a vaccine for it, why risk it? This vaccine is both for men and women, not just for women only. Both men and women can take this vaccine. Another infection condoms cannot fully prevent is genital herpes. Listen up. Genital herpes causes blister or sore around your mouth or genitals area. But here's what makes it tricky. This virus can actually spread even when there is no visible sore. That means someone may actually look healthy and still pass this infection through skin contact. And again, if herpes sores, if there's an outbreak located in areas that are not covered by condom, areas like your pubic hair, your thigh, or your buttocks, condom cannot block that contact. Genital herpes currently has no permanent cure and no approved vaccine yet. That is why you need to be careful because once this virus enters into your body, it stays in your nerve cell for life. That is why infection can sleep in the body and later reactivate, causing an outbreak, something like blister or sore. However, the good news is that it can actually be managed. Yes, you heard me. This virus can be managed with antiviral medication, so there's no need to panic. Some people take this medication only during outbreak when they experience outbreak like blister or sores around their genitals or maybe around their mouth. While for others, they can take it daily as suppressive therapy, particularly if outbreak keeps happening, keeps reoccurring. Scientists are already working on this herpes vaccine, while several are already on clinical trials. But as for now, there is no widely available vaccine that are approved for genital herpes. And number 3 is syphilis. Now let's talk about syphilis. Syphilis usually starts like a painless sore called chancre. Now listen up. If this sore is located areas that your condom do not cover, Transmission can actually still occur during sexual intercourse, that's intimate contact. You can contact syphilis from touching someone, but only if you have direct contact with an active syphilis sore or rash during intimate skin to skin contact. For instance, if you have a physical cut or a scrape around your skin and it comes in contact with someone with active syphilis sore or lesion, transmission can actually occur. This is why condom reduces the risk of syphilis transmission, but don't completely eliminate it because of this intimate skin to skin contact on an active sore. And lastly is scabies. Scabies are caused by tiny parasites that spreads through close contact. Condoms can't stop this because they live on your skin, they live on your hair, and not inside body fluid. Now, this doesn't mean condoms are useless. In fact, this is far from it. Condom remain one of the best tools we have for reducing sexually transmitted infection and unwanted pregnancy. But the key thing is understanding that they provide protection but not perfection. And there are situations where condom may fail, particularly if they break or expired, or maybe they are used incorrectly. So even if you're using condom, if the condom is expired, maybe you're not aware, there is still risk there. If it's not used correctly, because not everybody that knows how to use this correctly, then there's still risk. And if the condom breaks during sexual intercourse, there is still risk. So what can you actually do to protect yourself? Firstly, use condom every single time. Use it correctly. Secondly, get regular STI testing, especially if you have multiple sexual partners. Some of you, if I ask you right now, when was the last time you went for STI screening test? And some of you cannot even remember. Yes, maybe 5 years ago, 10 years ago, is very, very bad. If you have multiple sexual partners, then you should be testing at least every 6 months. And thirdly, consider vaccination for infection like HPV and hepatitis B. At least these ones they have vaccine, so why risk it? And finally, open communication with your partner about sexual health. It is extremely important. Talk to them. What is your sexual, particularly if you are intimate with this person? Don't just go along and have sex with that person without proper screening. Talk to them, open up, know their status. It is your right to protect yourself. You may want to, both of you can go to the hospital and do some screening test just to be sure that you are sure of your partner's status. Then you know that you are good to go. And the more informed you are, the safer you can be. And honestly, sexual health is not just about avoiding disease. It's about protecting your future health, your fertility, and your peace of mind. So it's your right to know your partner's status. Don't just keep quiet. Communicate. Yes, communicate. If you find this video helpful, don't forget to give a thumbs up, like, subscribe, and share. Bye.